I left the operating room to fight for physicians on Capitol Hill. Here's what happened. A couple months ago, I flew out with the Texas Orthopaedic Association to the AAOS National Leadership Conference to meet with lawmakers and advocate for health policy. Day one was no joke. We had hours of back-to-back briefings on legislation threatening patient care and physician sustainability. We went over everything from new Medicare programs, physician fee schedule adjustments, to facility payments. I had time for a quick bathroom break, and then it was back to strategy sessions. Before the Texas delegation dinner, I squeezed in a little sightseeing, the White House, the World War I Memorial, and what I thought was the Library of Congress. I picked up a banh mi and found a spot in the Freedom Plaza to enjoy. Y'all, let me tell you, it was one of the best I've ever had. 10 out of 10 if you're in DC. Then I parked myself under America's giant #2 pencil to study and prep for the next day. Caught the sunset, then dinner at Daru with ortho leaders from across Texas. It was good conversation, but the food was questionable. After that, I went back to my hotel and straight to bed. The next morning, I woke up early to get ready. Yes, I wore the same outfit. Yes, the hotel has a laundry service. Yes, it was also my birthday. Took a minute to review my notes while waiting for the Uber. We had 6 meetings scheduled for the day. We started with Senator Ted Cruz as legislative director. Then we walked outside and past the Supreme Court to the Representatives building for rapid fire sessions with staffers for Representatives Dan Crenshaw, Randy Weber, and Nathaniel Moran. Our focus was 3 issues: restore military medical research funding, tie physician reimbursements to the Medicare Economic Index, and remove the moratorium on physician-led hospitals. We checked out AOC's famous sticky note wall, met with staffers for Al Green, caught Henry Cuellar right before he went for a vote, and spoke with staffers in his office, which probably has the best view of the Capitol and a cool coin collection. Ended the day with a couple selfies. Here's my longtime mentor, Dr. Panchpavi, who's also the current TOA president. What an experience. When I walked into those offices, I wasn't just another email or signature on a petition. I was a real person who could explain where we're going wrong. Not in theory, but with actual patient stories and experience. I could answer questions on the spot and build relationships with staffers who will remember our conversation the next time legislation crosses their desk. And here's the uncomfortable truth. If physicians don't claim our seat at the table, someone else will speak for us. Insurance companies, hospital systems, and pharma have entire teams to get what they want. If you want change in healthcare, you have to push for it. Join TOA, AAOS, or your specialty organization's policy arm. Meet with your representatives. Go to your state capital in DC. There's still hope. We haven't lost yet.